Hi, it's the Houston Chiropractor, Dr. Gregory Johnson, D.C. Today I'm going to show you what a spinal decompression looks like on the y-axis. Now this is not like your other spinal decompression machines, which are basically just traction machines. What I'm going to do today, and I'm going to show you, is I'm going to decompress this patient's spine from his skull all the way down to his pelvis, his sacrum. So all 24 of his entire vertebral column are going to decompress and then reseat themselves, taking pressure off of the disc and the nerves. Now the most important thing on this is patient placement so that you can actually lock the pelvic bones in place. Now there are holes right here in the middle made out of steel plate, and you'll see that these holes have like different sizes and different widths for the size of the patient. So what I do first is we bring the patient's legs up at a basically 90-degree angle and have his lower legs parallel with the floor. Now as you can see, this changes the entire angle of his pelvis. We get his legs up to where they're parallel with the floor, 90 degrees, changes the entire pelvic angle, relaxes all the paraspinal muscles all the way from the pelvis to the skull, the actual occiput. So the next thing that we're going to do is we're going to take a plain old bath towel, we get it wet, and we fold it up tight like this, and we put it directly, go ahead and lay back, under the patient's head and get it right on the occiput, cross that over here, and get that patient ready. And then the thing that we do last, because this is kind of tight on the patient's pelvis, but you want it in there tight because you want to fixate the pelvis. So once I get him pinned in, you always instruct the patients to keep their mouth closed and make sure their tongue's not in between their teeth. And then I get down and I actually get a complete, almost martial arts stance. I get a nice pull here. I watch his breathing. And then as soon as he lets it out, I hit him straight vertical. It's a high velocity, low amplitude thrust that decompresses his entire spine from the skull all the way down to the pelvis. That's our decompression lesson for the day. This is your Houston Chiropractor, Dr. Gregory Johnson. Thank you for watching, and goodbye.